Hi, my name is Jennifer Halfaker, and I'm a practice facilitator with the Department of Family Medicine's Practice Innovation Program.
And I'm Allison Gottsman. I'm on Jennifer's team, and I do work both in communities and with practices, and we're excited to talk to you about our work with Impact Behavioral Health. Our role on Impact Behavioral Health is predominantly working with the ambulatory care practices, which include OB clinics, family medicine clinics, and pediatric clinics. And I'm going to turn it over to Jennifer because she's actually the one that works directly with the practices and has a much better handle on how they've taken advantage of this program.
So the program, the region where we're at is a very small community, and they have a pretty vast difference between the socioeconomic groups. We focused on setting up community resources that follow parenting people throughout their pregnancy journey, including up to 1 year postpartum. And since this region is so small, they all know each other, they have community meetings, they have a shared data system where they use to refer and track the people and the babies.
The value of this program is recognition that patients need a lot more support than just the medical field and the delivery system can offer. So the beauty of Impact Behavioral Health is a very focused, targeted, intentional engagement with community resources and care navigators that the ambulatory care clinics can refer their patients to a navigator, and we anticipate that this will give whole person, well-coordinated continuum of services addressing not only their health-related concerns that the medical system identifies, but most importantly, their health-related social needs that the community organizations are well prepared to address. And I'm going to turn it over to Jennifer to talk about exactly how some of those handoffs are happening, the types of organizations that we are focusing on. Jennifer?
I have a clinic that is specifically, this was a concern, the continuum of care and making sure that patients got from, it was a women's health clinic, so making sure they got from women's health to then primary care, and also that the babies got to family care or a pediatrician. So they focus their work specifically on this. We're tracking referrals, and we've actually shown a big increase in referrals after our first quarter of tracking data. So I wanted to give an example of how the community worked together. They're a tight-knit community, and I had a provider who was especially worried about a group that she called the newcomers. And they were patients that had come that were new to the United States. So they were born somewhere else, they lived somewhere else, and then they came. And she found that these patients just really lacked resources. They lacked any sort of information about like school systems, healthcare, transportation. And so she was actually really worried about these patients, this group of patients. She took this to her community partner, and they actually set up a support group specifically for what she called the newcomers, and it was a newcomers group. And it's been really successful, and it's really given the patients and the community a place for them to be and learn.
My recommendation for people considering engaging in a full-scope, comprehensive continuum of care initiative in a community, which I wholeheartedly support, would be before you make the commitment to the community, make sure you understand the culture and the needs expressed by the delivery system, as well as the needs and understanding of the community organizations, and in a perfect world, identify some patients in your target population to get their perspective. So as you are formulating a project in a new community, you're tailoring it to the unique needs of each community, which we've learned, even in this very small region, the differences of the populations they serve, the values in population that the medical team has, as well as the community resources are all essential. There's no doubt every community could benefit from an approach like this, but I would recommend that you do your assessment first before you identify your partners, the resources you're going to provide, and then work with the voice of the community very strongly in your planning process.